Hello, my name is Joe Murray. I'm a gastroenterologist in the celiac disease program at Mayo Clinic in Rochester. Today I'm talking about a recent paper published on a rather controversial topic, and that's non-celiac gluten sensitivity. There had been a working diagnosis of non-celiac gluten sensitivity, which basically encompasses individuals who don't have celiac disease but who experience symptoms when they are eating gluten-containing foods that get better when they avoid them. An Italian group, Zanini et al., recently published a study. They recruited patients who had put themselves on a gluten-free diet, did not have a gluten-free diet, but reported that they had improved on avoiding gluten. And they put them on a double-blind crossover challenge where they gave them little sachets, and these sachets either contained gluten-free flour or gluten-containing flour. And they were instructed to sprinkle them over other foods and see if it produced symptoms or not. They found that only a third of the patients actually could tell that they were getting gluten. 49% of those responded, or 49% of people, almost half of them, of the subjects, responded to non-gluten containing flour. The symptoms that people experienced were the fairly typical GI symptoms: diarrhea, constipation, abdominal pain, but also fatigue, tiredness, and other symptoms. But it was the GI symptoms that were the ones that occurred in the patients who could correctly recognize that they were getting gluten. Now, what does this mean? Well, for research, if we are recruiting people for studies based on their own identification of avoiding gluten and feeling better, it means probably only a third actually have it because of gluten. Their symptoms are likely, as Zanini et al. Have suggested, caused by other flour components, things perhaps like FODMAPs, which are small sugar or alcohol molecules that are common occurrences in many foods that can also produce GI symptoms. So where does this leave us? Well, the field of non-celiac gluten sensitivity continues to be fraught with difficulty for patients, for doctors, and also especially for researchers. And I'm sure there will be further studies to follow. Thank you.